Hi, my name is Anton. I'm a fifth-year medical student at the Karolinska Institute in Stockholm, Sweden. This is the second part of a three-part video about our trip to Tanzania during the course in global health, started by the great Hans Rosling. If you would like to watch the first part, it's gonna be linked up here. After a week on Kilimanjaro, sleeping in a tent next to Frey for way too many nights in a row, it was really nice to finally meet up with everyone and start the course in Dar es-Salaam. The following week, we all got stuffed into one of the university buses, with the bus driver Kapinga driving us around the city to explore different parts of the healthcare system. The welcome we got from everyone involved was just amazing. Just like in the Swedish healthcare system, doctors, nurses and other staff members are working really hard under a lot of stress, with quite limited possibilities to change the circumstances under which they are working, which just made it that much more special when they took the time during their day to show us around and show us the work that they are doing, the difficulties that they are facing and how they're trying to solve the problems to ultimately improve the care for their patients. As this was the first time for me outside the context of Swedish healthcare, I was constantly amazed by the differences between how they did things compared to how we do things. When you take into account the attitudes of some of the senior doctors here in Sweden, it's safe to say I'm glad there's more than one way that lead to Rome, and that it's very rare a problem only has one solution. The first day we went to Muhimbili University Hospital and were divided into three groups. We either went to gynecology, pediatrics or internal medicine. These were half-day rotations, so throughout the beginning of the week we were able to see all three clinics. Straight away I noticed some quite big differences in comparison to Sweden. First off, they had waiting rooms and patient transportation outside, which would be as you can imagine, would be quite difficult here in Sweden. Secondly, one of the first interactions we had with their lack of resources in comparison to us was the use of hand sanitizer. Here in Sweden we use it in abundance, and there is literally a bottle in pretty much every corner of the hospital. At Muhimbili, the access to hand sanitizer is much more restricted. For example, at the internal medicine ward, one of the attendings was carrying around a bottle and had staff members come to her in order to prevent overuse. We got to meet with patients at all the clinics. And one case I particularly remember. A mother with her son who had been referred to the university hospital as her son had gotten a spinal cord infection. Even though most of the healthcare costs for children under 5 are subsidized, the doctors had to perform both a CT scan and an MRI, which isn't covered by the government's universal insurance. She had to ask all her family and friends to contribute towards the medical bill, and they had been able to collect about 1/4 of the money. This would mean that if she wouldn't get help from the social services with the rest, she would be in debt for the rest of her life. Shocked to hear this, I asked how much she owed the hospital. About $150. My first instinct was that I wanted to help her pay the bill, but as I discussed this further with the physician showing us around, he told us that in the next room there are at least 20 patients in similar situations. So even if I, as a Swedish medical student, would be able to help one of them, I could never help them all, which really highlighted the fact that you should never shove or push people out of poverty, but instead stand on the sides and cheer them on, and give them the tools they need to make it on their own. The next day we went to a non-governmental organization who were working towards eradicating HIV and AIDS through preventive measures and spreading awareness. We met with a band who played music at events and on the streets to gather people's attention, and when they were done playing music, they talked about how the people in the crowds could help to stop the transmission of the disease. Later during the week, we got to listen to lectures from all kinds of medical staff, talking about their work and their research. Coming straight from the cold winter of Stockholm, the heat really took a toll on us before you got used to the climate and temperature of Dar es-Salaam. At the end of the week, we had presentations regarding selected patient cases, and we also got the opportunity to thank the people organizing all the clinical rotations. After that, we got the weekend off, so together with 3 friends, we booked a hotel room at one of the hotels in Dar es-Salaam and prepared for a week in Mlandisi.
Ja, tjena grabbar. Är vi här på Sheraton. Sista dagen innan vi drar ut i vildmarken så att säga. Vilket vanligtvis innebär Huddinge. Men idag och veckan som kommer så innebär det Mlandisi. Hur skulle du säga att det känns?
Ja, lite svajigt ändå. Jag har ju förberett med powerbanks, pannlampa, tvätta alla kläder. Sen är det någon vägglös.
Ja. Nej, vi har undermåligt med demor. Det har vi.
Ja.
Men ja. Det är bara att hoppas på det bästa.
Ja.
Skål.